So as an introduction to lip augmentation with dermal fillers, I'd like to talk a little bit about the products that are available. And in our practice, and I think, in general, really you should be using dissolvable, non-permanent materials in the lips. This is a very sensitive structure. You use your lips to speak, you kiss with them. These are very delicate structures, and I think permanent materials gone wrong in the lips are one of the most common complications of permanent fillers that I see in my practice. So I really recommend that people stick with the non-permanent fillers, and these days they're predominantly made with hyaluronic acid, and that's a natural substance that occurs in our tissues. We don't seem to have a potential for allergy against it, and people just generally dissolve that material as part of their metabolism slowly after the injections occur. So one of the myths around lip augmentation is that the goal is to create really large lips, and I'm sure people have seen examples of that walking down the street or on the internet. There's much more to it than just adding volume. I think the shape of the lips is often in need of changing. Some people have a little bit of asymmetry to the lips, and as we age, not only does the volume go down, but I think we start to lose some of the volume around the lips, and sometimes a little bit of modification in some of the folds or even in some of the volume of the upper and lower lip can really help to rejuvenate that area without necessarily having to have really large lips. Our nurses are providing injectable fillers for our patients all day, every day, and they're experts at this. Not only are they experts in assessing what's going to look good and areas perhaps in the perioral area that might also require some modifications, but they're adept at choosing the right product for the right patient and also the right technique for injecting the fillers. Just as an example, many of our patients benefit from having a cannula used to perhaps outline the border of the lip. And this is a sort of an advanced technique that not everybody does, but I think can be very useful in getting a really good result. So a good lip augmentation is not a one-size-fits-all. It's not a matter of just injecting a whole bunch of volume into the lips. It's about rejuvenating the perioral area and creating some balance. So that the distance of the upper lip relative to the lower, the volume of the vermilion lip, they all have a part to play in the aesthetics of the mouth. And I think our nurses are extremely adept at assessing what are the little things that could be improved in addition to just adding volume to the lips that will give patients a really good result. And just as an example, sometimes the nurses will suggest a little lip flip procedure where we just use a very small amount of Botox, and that can affect the contour of the lip as well. And that's not really a filler, that's something that relaxes some of the muscles. So there's little things that can be done that really have an impact on the outcome, above and beyond just putting a whole bunch of filler in there. So experience is very important. I think that it's the most important determinant of a good result.